Hi, this is Dr. Dumestre, board certified plastic surgeon. Thank you for this question. So basically asking, you've had the diagnosis of breast cancer, you're pursuing a double mastectomy, and you've decided you do want reconstruction, you want to restore the breast. So the two main options in this scenario is implant reconstruction versus using your own body's fat, which is the DIEP Flap transfer from belly up. Now, there's a bunch of factors that go into deciding whether you're a candidate for one, the other, or both. And those are things that we go into in your consult. Now, assuming that you are a good candidate for both forms of reconstruction, which is the case for a lot of people, what are the pros and cons for implants versus DIEP Flap? Now, my natural bias is to go towards the DIEP Flap, and that's just because of an overall decreased complication rate and decreased need for long-term maintenance. So going into the specifics of that, the pros of a DIEP Flap reconstruction using your own tummy tissue is that this is a permanent reconstruction. So once you're done, once you're happy with your outcome, you're done. There's no need to have maintenance surgeries, replace the tissue like you would an implant. This is your own body, so there's no need to do any of that. You're cancer-free, you live on with your life. Now, this tissue is also metabolically active because it's done as a same person transplant. It tends to behave like the rest of you does. So as you gain weight, lose weight, your breast will gain and lose weight with you. They will droop and sag as the rest of you does. So it's a very natural reconstruction. On that note as well, it gives a very natural appearance and feel. So we're replacing fatty breast tissue with fatty tummy tissue. It's nice and soft, and it also sits from a side view more like a breast. So a little bit flatter on the top, down to that kind of nice fullness at the bottom. There is a decreased risk of infection with DIEP Flap, both in the acute setting, so in the first couple months, and also long term. Because there's no foreign object in your body is able to provide circulation and fight whatever little infection wants to arise with time, whereas the implant is a foreign object, so any bacteria that actually gets on to the implant surface, onto its biofilm, cannot be reached by antibiotics. In the initial phase, after implants, there's a high risk of infection because you've lost the blood flow to that mastectomy skin and you're simultaneously putting in a foreign object to that area. And then there's actually a long-term risk of infection too. This is most common if you've had an infection in your early phases and you never got that implant replaced, it just got resolved with IV antibiotics. Then there's an increased chance of presenting with a delayed infection years down the line. DIEP Flap is great with radiation therapy. So if you have a history of radiation, you've got really thick, non-elastic tissue or poor quality skin, we don't have to worry about breakdown or thinning or poor stretch the same way that we do with implants. And having all of that healthy, non-radiated tissue can actually help with some of that skin quality as well. The look of DIEP Flap versus implants isn't really a pro or a con, it's just a personal choice. So some people really love the look of their implant reconstruction. They get that cleavage, they get that really big fullness up top that's kind of more similar to a cosmetic breast augment, and some people are not looking for that at all. They want to be restored back to as natural a look as possible. The downsides or cons of a DIEP Flap is that you are doing a donor site. So potential for donor site morbidity, meaning where we actually take that tummy tissue, you can have problems with healing or pain there that are unrelated to the whole breast cancer diagnosis. It is a longer surgery. It usually takes around 8 hours or so for a double mastectomy, immediate DIEP Flap reconstruction. I do keep my patients in hospital for 3 nights afterwards to monitor the circulation, so there's a hospital stay involved, and there's increased recovery time. I would say on average, it takes my DIEP Flap patients about 3 months to regain their full energy, feel back to themselves, and for my implant patients, it takes them about 2 months. Implant pros and cons are pretty much the opposite of that. So the implant pros are that there is no donor site. We're not making cuts anywhere else on your body. It's a slightly shorter surgery, although the initial one is usually still kind of 4 to 5 hours. And it does not involve hospital stay. You can go home same day, and the time to regaining your full energy is shorter. The implant look we talked about sits a lot higher, a lot rounder. And then the downsides of implants are that they do require lifelong maintenance. So at some point in time, you have to switch out your implant. Implants these days are lasting closer to 15, 20 years, but most women are going to need at least one more surgery throughout their lifetime to exchange those. The increased risk of infection, and the fact that there is minimal sensation. So even with our sensation restorative surgeries with implants, we can do a little bit of nerve transfer for that. The complaints are that the implants don't necessarily feel part of you. They can feel really cold. Even your skin on top of it can feel cold. Whereas with the DIEP Flap, that was actually a pro I forgot to mention, is that that is your best chance of regaining some sensation. Now, it's not full sensation that we're looking for, but at least some feeling that that filling that's in your breast tissue is actually yours. I do a nerve hookup to do that, and it can actually improve some of the sensation of the overlying skin as well. So those are kind of the pros and cons. From a pain perspective, what I tell my patients is I wouldn't let that or the recovery time dictate which one you choose. Given there's so many other pros and cons, I would go based off of those factors. I have patients who do extremely well after their DIEP Flap. I come in to see them day one after surgery. They barely look like anything's happened. Same thing with implants. I have patients who do really, really well. On average, people are going to take their pain meds for the first week or so with both cases. And then I have patients in both groups who really struggle, who even at 2 weeks are in a lot of pain. They're still very fatigued, having a tough time, and I see that with both groups. So yes, the DIEP Flap's a bit more upfront recovery, but I would say it's not significant enough that I would let that dictate your choice. Again, assuming you're a great candidate for both. Hope that helps make your decision. These consults usually take about an hour. It's a lot of discussion. So this is a very quick overview, and then your surgeon can further help you make that decision. Have a great day.